on this model, right? This would be the external nares. And then we see that we have a view of the internal nasal cavity, right? So this anterior portion would be called the nasal vestibule, right? This is where we have the opening of the external nares into the nasal cavity. So nasal vestibule. Then we can see the inferior, middle, and superior conchae, right? So these flat shelves we know are the conchae, superior, middle, and inferior. We know that they are lined with mucous membrane, and we know that they help to conduct airflow into the deeper passages. We also know that there are epithelial cells on this mucous membrane that are important for sensation of smell, right? Olfactory sensation. You'll notice that we have these grooves. Those grooves are called the meatuses, right? And we know that that's going to help humidify the air. We talked about that in lecture. It warms that air, moistens the air, so that it can go eventually deeper into the air passages. So very important for conduction. Let's see. This right here is the hard palate. This bone right here would be the hard palate. And then this that's drawn in red is a little bit softer tissue, so this would be the soft palate. So we have the hard palate, and then we have the soft palate. Where the nasal cavity opens into the pharynx, we know that this would be the opening to the nasal pharynx. And you see that little depression? We know that that is the internal nares, right? The internal nares. We can also call it choana, right? Because we just see one. We know there are two, so choanae is plural, but we just see one, so that would be choana. And it opens into the nasal pharynx. If we come down here, this is the oral cavity, right? So this opening into the oral pharynx would be the fauces. So right where the oral cavity opens or meets or communicates with the pharynx, we know that opening is called the fauces, and this would be the oral pharynx. And we know the oral pharynx extends to the hyoid bone. So you see just the tip of the hyoid bone here. You have a better view from the front, but we know that this is where it becomes the laryngeal pharynx. So below here, it is the laryngeal pharynx, and we know that opens into either the esophagus or into the larynx, which would be right here. Okay, so those are the structures you should be able to identify on this model. Okay, we switch over. We're going to pick up with the larynx. Okay, there's two pieces of cartilage I would like you to identify. We have the thyroid cartilage, which is this top broad piece that looks like a shield, right, made up of hyaline cartilage. And then we have the ring of the cricoid cartilage that is also made up of hyaline cartilage, right? We know that this right here would be part of the thyroid gland, right, located in this region. And then we see the trachea, which is identifiable because of the rings that we know are made up of hyaline cartilage. We come down here, we see our lungs. If we pull them out, we see that we can identify lobation, right? We have the superior, middle, and inferior lobe. You can see it on this lung. You can also see it here as well, superior, middle, and inferior lobe. If I pull out the left lung, I see that the left lung is smaller than the right lung. We talked about that. I see that it only has two lobes, right? Superior and inferior. We know that this is the oblique fissure, and you don't have a great view of the oblique and the horizontal on the right side, so I won't ask that. You'll notice also the notch on the left, right? We know that this indentation is for the cardiac placement of the heart, so we call it the cardiac notch. And then we have the diaphragm, which we know is made up of skeletal muscle, and we can see that very clearly from this model. Other things you should be able to identify. We know this is the aorta, right? We know this is the pulmonary trunk, which is eventually going to give rise to the pulmonary arteries, and we know these are the pulmonary veins going into the left atrium, right? So you should be able to see the vessels on this side especially. So you want to be able to identify those as well. Okay, and that's all of these structures on this model. Okay, so make sure that you can identify those respiratory structures. The last